Good afternoon and welcome to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thank you so much, Margie, for providing your services, and thanks to all of you for tuning in to learn more about the latest local developments, how to keep yourself and your loved ones safe, and how to help end this pandemic. Over this past weekend, photos of high school seniors headed to prom popped up in my Facebook feed, and my heart just warmed to see them enjoying this milestone of youth, posing together against a backdrop of green grass and yellow daffodils, smiling and stunning in satin, in tulle, and in tuxedos, with coordinating cummerbunds and even matching masks. And as I admired the joy that they radiated, I also just marveled at how these teenagers on the verge of adulthood have adapted during this pandemic. Along with the normal milestones of this time in their lives, going to prom, getting a driver's license, registering to vote for the first time, this generation is uniquely being called upon to add another new milestone, getting vaccinated. And whether they answer that call to get vaccinated because they want to protect their grandparents or a friend with an underlying health condition such as asthma or diabetes, or because they know what an important part they play in achieving herd immunity and helping to end the pandemic, or because they just want to get to be able to go back to big concerts, or even if it's just to get that free Krispy Kreme with the proof of a vaccination card. We are pleased to announce that the Lincoln-Lancaster County residents age 18 and older are now able to sign up for vaccination appointments this week. So this means it's very important that all of those ages 16 and older who have not yet registered for a vaccine do so as soon as possible. We're really moving through it quickly, and the time to register is now. To register, you just visit covid19.lincoln.ne.gov and click on the Vaccine Information tab. And those who do not have online access or who need assistance can call our COVID-19 hotline at 402-441-8006 to register. And getting registered is easy, takes less than a minute, and it ensures that you will be contacted for an appointment at one of our local health department vaccination clinics. Now, as we have throughout the pandemic, we continue to take the thoughtful, measured steps based on data to move us closer to where we want to be. And this approach has been successful. And today we want to share updated information with you about how Lancaster County compares to other areas of the state. You'll see here that every county in Nebraska is covered by one of 19 local health districts. And throughout the pandemic, these health departments and districts have worked with their communities and with each other to help prevent the spread of COVID-19. We have seen some similarities in how local health districts have responded, as well as some differences based on the situations in their areas and the needs of their communities. All of us have had to make tough decisions as a result of this pandemic. No health district has been immune to this virus. All have counted cases and lost too many of our residents to COVID-19. And what we want to highlight today is that data we continually review and monitor demonstrates that our local preventative health measures and collective efforts have made a significant difference for Lincoln and Lancaster County. We're going to look at two updated data comparisons that we have shared with you previously. First, we will look at the fatality rate, the number of deaths per every 1,000 COVID-19 cases. And the second, we will look at the case rate, the number of cases per 100,000 residents. In this chart that illustrates data current as of April 10th, we see that the fatality rates among the 5 most populated counties in the state. Now, the top bar in red represents the fatality rate for the entire state, which is 10.9 deaths per 1,000 cases. And as you look at the rates for the 5 most populated counties, you'll see that Lancaster County has the second lowest fatality rate at 7.6 deaths. This chart looks at the case rate, the number of cases per 100,000 population, again for the 5 most populated counties in the state, as well as for the entire state represented by the red bar on the right. Lancaster County is the blue bar on the left, and where you see that we have the lowest case rate at 9,465 per 100,000 population. Here are some statistics that put these differing case rates in perspective. Lancaster County has had 30,251 confirmed cases of COVID-19 since the pandemic began. Now, if we had had the same case rate as the state, we would have had an additional 5,000 cases in that total. And if we had had the same case rate as Douglas County, we would have had another 8,000 COVID cases. We recognize that there are many factors that can impact the rates statewide, but this data shows that we have made a difference by our individual and collective actions, our more robust preventive health measures, our earlier mask mandate, our businesses' commitment to protect their customers and employees, and our residents' strong desire to do their part to protect one another. Together, our community members' efforts have helped prevent illness, keep our businesses and schools open, and save lives. Lincoln-Lancaster County's steady, data-driven approach will continue to undergird our strategy to move past this pandemic and to avoid any resurgence of the virus or its variants. Vaccinations are a focal point of this strategy, and we are so pleased to report that our community members understand this and that our local demand for vaccine remains strong. As of today, 39.5% of our residents aged 16 and older are fully vaccinated. How Lancaster County compares with the rest of the state in the percentage of those fully vaccinated varies day to day, but we are incredibly pleased to report that as of this morning, we were number one for the percentage of residents fully vaccinated. We have consistently been in the top third out of the 19 local health districts in recent weeks. And with that, I will turn this briefing over to the leader of our amazing local public health team, which has set an incredible example for the rest of the state with their efficient and equitable rollout of the vaccine. Health Director Pat Lopez.
Thank you, Mayor. As the Mayor said, data plays an important role in public health, and it helps drive the decisions we make to improve and protect the health of our community. Data is a valuable resource that provides us with measurable outcomes to help ensure that actions we take are effective. When we look at our dial metrics, last week I mentioned that we have been in the process of reviewing the data metrics for the risk dial based on the availability of additional data. This afternoon, Raju Karkapaludi, our public health epidemiologist at Lincoln-Lancaster Health Department, is joining us to tell us about the addition of 2 metrics to the risk dial. Raju?
Thank you, Pat. Thank you, Mayor. The COVID risk dial was developed to help communicate to the public the risk of spread and impact of COVID-19 in the community. Since the inception in May 2020, we have used primary metrics based on local data: positivity rate, cases, testing, contact tracing, and healthcare system capacity. We have now added 2 additional metrics: vaccination rates and deaths. Data on these 2 metrics were not available during the development of initial risk dial, but now we have better understanding of local risk for COVID deaths and can track progress of vaccinations. They both will add value to evaluating the risk of spread and impact of COVID in the community. Deaths due to COVID-19 are a hard reality and a definable outcome of this pandemic. Deaths are considered a trailing indicator since most often occur weeks after the onset of illness from COVID-19. The table on the left shows the number of deaths Lancaster County residents in each month. To date, 87% of COVID-19 deaths have been in persons 60 years of age and older. To capture the ongoing impact of the community, we are using a 3-week rolling average of deaths per week as a new metric. A new surge of a different variant could make our cases, hospitalizations, and deaths increase. On the other hand, increased vaccinations will result in fewer deaths. Using death as a metric allows us to quantify this impact on our community as we move forward. This is why this is an important metric to help measure the public health impact of COVID-19 into the future. The chart on the right shows the metric data and the color related to the risk dial. At the peak of COVID-19 cases and deaths in December, we are at a 3-week rolling average of 17 deaths, clearly in the red, which is much greater than 7. Currently, we are in yellow for this measure at a 3-week rolling average of 2. Vaccinations. With the administration of vaccine in older adults, we are already seeing the benefits in terms of public health impact with reduced number of cases in older adults as well as fewer hospitalization and deaths. We continue to see a high demand for vaccine. Coming into this week, we are now nearing 80% of those 65 and older receiving at least first dose of vaccine, and we continue to make progress to get more individuals fully vaccinated. It remains unclear the exact percentage of population that needs to be vaccinated to stop the spread of COVID-19 in the community. The World Health Organization, the CDC, and the number of infectious disease experts around the world suggested anywhere between 60 to 80% of the population needs to be vaccinated to achieve herd immunity. Based on these highly reputable sources, health departments set a goal of having 75% of eligible Lancaster County residents fully vaccinated. Vaccinating 75% of persons 50 years of age and older will be a key milestone in reducing the impact of COVID-19 in our community. Since that age group includes a vast majority of persons who have an increased risk of hospitalization due to COVID-19. The chart shows the metric and data and the color related to risk dial. This chart shows that we are just under 35% as of this afternoon, but we just refreshed the data to 39.5% for those 16 and older that are fully vaccinated. So this vaccination metric is currently in the red. Today, for this new vaccination metric forward, progress out of red will utilize the following criteria. We'll be looking to get between 45 and 60% of the community members fully vaccinated to move into orange, between 60 and 75% to move into yellow, and 75% or higher to reach green. Please keep in mind that these two metrics are now part of weekly review of COVID-19 risk dial. One metric does not control the position of the dial. All factors are analyzed and collectively factored into review that determines the position of the dial. Thank you.
Thank you, Raju. It's really important to be able to share these metrics. As we have from the very beginning of this pandemic, our health department wants to ensure that we are clearly communicating the risk of COVID-19 spread to our community and the public health impact of that spread. These 7 metrics were developed by our health team based on reputable public health resources, as Raju said. The team includes staff that have decades of experience in epidemiology, outbreak investigations, and biostatistics. The COVID-19 risk dial provides the most robust description of the risk of spread and the public health impact in Lincoln and Lancaster County. As our knowledge of pandemic and intervention grows, revisions may be made to these metrics and the thresholds. This week, our risk dial will remain in the mid-yellow for the 9th week, indicating that the risk of the virus spread and the public health impact in our community continues to be moderate. Over the last 9 weeks, the number of new weekly cases has averaged 337. The number of cases dropped from 360 the week ending April 3rd to 346 the week ending April 10th this past Saturday. Our rolling 7-day average of new daily cases has fluctuated very little over the past 3 weeks. We ended last week, Saturday, with that 7-day average at 49 new daily cases. Our positivity rate has also stayed fairly flat for the past 9 weeks of about 4 to 5%. The positivity rate is a leading indicator, so we continue to monitor it closely. And our hospitalizations have seen great improvement with local hospitalizations during this past few months. The 7-day rolling average of patients hospitalized has dropped from 70 on January 22nd to 13 on March 28th. But since then, we have seen a gradual uptick in hospitalizations in Lancaster County residents. The average was back up near 22 last week, ending April 10th. This is concerning as we are watching this data closely to better understand the demographic of these hospitalizations. Today we are reporting 27 hospitalizations, with 18 of them from Lancaster County. This map shows how our local metrics are plotted to determine the position of the risk dial. You can see the metrics of contact tracing, average, testing, turnaround time, and the death rate are all near green. Hospital capacity is in yellow. You will see that the case rate and positivity rate are in the orange category, and the metric for vaccination is currently in the red category. Finally, you will find the location of the risk dial in yellow at the middle of the chart, represented by the blue square outlined in red. With the dial in yellow, we are still asking everyone to continue to exercise caution, even if you are fully vaccinated. We are seeing an increase in COVID-19 cases in many other states, including cases from new and emerging COVID-19 variants. These variants are mutated versions and have the potential to cause COVID-19 to be more severe, spread more easily, require different treatments, or change the effectiveness of our current vaccines. Just yesterday, we confirmed 2 more local cases of the variant B117, known as the UK variant, in Lancaster County. We now have 12 local cases of the variant and 6 cases of the 2 different California variants. According to the CDC, scientists continue to learn more about how the vaccines protect people from variants. Dr. James Lawler joins us today by Zoom to provide an update on the variants. Dr. Lawler is the Executive Director of the International Programs and Innovation at the Global Center for Health Security. He is also an Associate Professor of Medicine at UNMC. Dr. Lawler, thanks for joining us today.
Pat, thank you for inviting me, and it's a pleasure to be able to speak to folks today. I think your report on variants is very timely, as this is becoming more and more of a concern for us who are followers of the COVID-19 pandemic and the epidemiology of the viruses that we're currently facing. So what has happened for us in Nebraska and across the United States over the last several months has been, fortunately, an overall decline in the number of COVID-19 cases that we've seen. And this is, I think, in large part due to many of the interventions that were put in place to help to mitigate the spread in communities. Unfortunately, what's happened over the last several weeks now, and this is particularly true along the East Coast of the United States and in now the upper Midwest and Michigan through to Minnesota, as we're starting to see a resurgence of cases. And these cases appear to be predominantly of these new lineages or variants, the most significant of which in the US is the UK variant, or B117. The Centers for Disease Control estimates at this point B117 probably makes up the majority of circulating viruses, coronaviruses causing COVID-19 in the United States. That's to say that over 50% of the viruses and 50% of the infections that we're now encountering are COVID-19 due to the B117 variant. That's even more so in Michigan and these other states, which appear to be leading this cresting wave of resurgence. In Michigan, it's estimated that close to 70% of new infections are due to the B117 variant. And what we know about this new variant in particular is that it is much more infectious than the old wild type virus that we encountered, probably 50% or 60% more infectious. We also know that it causes more severe disease than the previous wild type infection and appears to be able to cause more severe disease in younger people. So in the United Kingdom and in Europe, and now in states in the US where they've seen B117 begin to predominate, there's been a pronounced shift in hospitalizations towards younger patients, and that includes patients who've required intensive care unit admission and intubation. And so we're very concerned that this trend of affecting more young people and causing more cases will drive continued increases in case counts across the US, including Nebraska. And again, we've seen an increased case count in Nebraska and will cause an increased number of hospitalizations. The good news is, counterbalancing this, we have increasing vaccinations across the state and across the country. But we are playing a bit of catch up in that respect, where vaccinating a significant proportion of the population where we really are able to suppress virus transmission is still a ways away. And because we initiated vaccination appropriately in our seniors and those who are most vulnerable, we did not vaccinate the proportion of the community that's most responsible for transmission. And so it's helpful to think of a community like a hand. This central part of the hand that is very connected to each other are young people and young adults. This is where respiratory virus transmission occurs, in these people who are tightly grouped and closely associated. Out here at the ends of the fingers are older folks and seniors who have fewer social connections, but they're the ones who suffer the worst consequences. So we've been vaccinating out here at the ends, and we're now just starting to approach the area of the palm, which is where most people are connected and where the vast majority of transmission events occurred. So what that means is we haven't really yet blunted the kinetics of how the virus transmits in the community yet, because we haven't vaccinated that portion of the population to a large degree that's mostly responsible for transmitting the virus. So that means we still need to stick close to those public health interventions that we've shown are very effective in reducing transmission and lowering the number of cases. That is, wearing a face mask when you're out in public, avoiding large gatherings, avoiding situations where you're indoors without a mask with other people, like indoor restaurant dining or bars. If we can continue to do those things for the next couple of months while we get the rest of that population vaccinated, we'll find ourselves in a much better position. If we're not able to do that, we run the risk of these variants actually overtaking our vaccination efforts, and we run the risk of seeing significantly increased numbers of hospitalizations and unfortunately deaths. And as we know, Nebraska has already experienced well over 2,000 deaths, and certainly more than we need to, and we would like to avoid that trend continuing. And finally, I will say that the last concern that I have and many experts have is regarding this new Brazilian variant, otherwise known as P1, which has not only caused large outbreaks in areas of South America that have already had large outbreaks of coronavirus and should have achieved theoretical herd immunity, but now we're seeing outbreaks of P1 in North America, in particular in British Columbia and Vancouver right now. There appears to be a large outbreak driven, at least to some extent, by P1 and also by B117. That's causing a huge surge in cases there, and their hospitals and ICUs in much of Canada are starting to fill again. And so we want to avoid that situation. And again, while we are vaccinating the rest of the population, we would like to see everybody continue to stick to those non-pharmaceutical interventions that got us over the hump in November and December. So I'll turn it back to you, Pat. Thanks.
Thank you very much, Dr. Lawler. Very helpful information. And I really encourage all of us to continue to follow those non-pharmaceutical measures that Dr. Mahler mentioned. And of course, one of the other things that's really important for our community is to get the COVID-19 vaccine as soon as it's available to you. Now I want to provide a vaccine update for you. There are some new developments today related to Johnson & Johnson. The health department paused the use of the vaccine based on recommendations from the Centers for Disease Control and Prevention and the Food and Drug Administration. Both federal agencies are reviewing data related to 6 reported cases, including one in Nebraska of a rare and severe type of blood clot in people after receiving the Johnson & Johnson vaccine. Currently, more than 6.8 million doses of the vaccine have been administered nationwide. We do not have any clinics scheduled this week to administer the Johnson & Johnson vaccine. All vaccination efforts previously scheduled to use Johnson & Johnson vaccine will instead use Pfizer or Moderna. Just over 11,500 doses of Johnson & Johnson vaccine have been administered in Lancaster County through clinics and federal retail pharmacy programs. I understand that people have concerns, and I want to remind residents that vaccine safety is a top priority. Any incident that occurs following the vaccination is taken very seriously. These adverse events appear to be extremely rare according to the CDC. People who have received the Johnson & Johnson vaccine who develop a severe headache, abdominal pain, leg pain, or swelling, or shortness of breath within 3 weeks after vaccination should contact their healthcare provider and seek medical treatment. Now I want to talk more about our vaccination efforts. We continue to make progress in our efforts. As of today, 141,212 residents have received 1 dose of vaccine, which is more than 54% of the population age 16 and older. As the mayor said, we now have about 39.5% of our population age 16 and older fully vaccinated. The COVID-19 vaccine helps protect you and the people you love, prevents illness, and saves lives. It is also a major factor in reducing the spread of the virus. At our clinics last week, we vaccinated more than 29,500 people, our highest number yet. Most of those who are vaccinated at our 4 large-scale clinics. We continue to see more vaccination opportunities opening up for our residents, whether it's through a health department clinic or through a local participating pharmacy in the federal retail pharmacy program. The situation is changing very quickly, so I also encourage all Lancaster residents who are 16 and older to complete our quick and simple registration process at covid19.lincoln.ne.gov. Parents with teenagers aged 16 to 18, please register them if you haven't already. We're working with the high schools in Lancaster County to set up vaccination clinics for students 16 and older whose parents wish them to receive the vaccine. The clinics will be held at the schools, and we will be providing more details in the very near future. Vaccination appointments are available this week for residents age 18 and older. As I mentioned, the situation is evolving, and vaccinations may be offered to those in younger age groups depending on the supply of vaccine and available appointments. As individuals in specific age groups are contacted to schedule vaccinations, family members living in the same household are able to schedule vaccinations as well. The health department is also reaching out to the hospital members of those in the age group previously, household members, of those previously vaccinated. We received 2,400 additional doses of Moderna vaccine this week, and we welcome the extra vaccine and the opportunity to vaccinate more members of our community. This week, we continue to collaborate with our cultural centers. and local churches to host smaller vaccination clinics for members of our community disproportionately affected by COVID-19. Cultural centers and churches are assisting individuals with registration. Yesterday, in partnership with El Centro de las Americas, we held a clinic at the Center for People in Need. About 240 people received vaccine. I want to thank the team at El Centro for their partnership in hosting this clinic. We look forward to a second dose clinic in a few weeks. In addition to that clinic, a first dose clinic was also held at the same location earlier in the day, and we administered close to 1,000 doses of vaccine. We're holding 2 more large-scale clinics Thursday and Friday at Pinnacle Bank Arena. And the Nebraska Department of Health and Human Services is also working with us to hold our community's first drive-through clinic. Those are scheduled for Wednesday, tomorrow, and Saturday at the drive-through garages in the north parking lot of the former Sears store at Gateway. Vaccinations are by appointment. And Moderna vaccine is being provided at those clinics. The state had planned to administer Johnson & Johnson, and we are now in the process of contacting people who have been scheduled appointments there and letting them know about the change in vaccine. Other vaccination efforts this week include working with higher education institutions to register students to receive vaccine. We are in the process of scheduling appointments for those who are registered, and we are still vaccinating. We will start vaccinating these college students at Friday's clinic at the arena. In partnership, we'll be registering additional students and get them scheduled for vaccination before they head home for the summer. We continue to partner with Bryan Health and CHI St. Elizabeth to hold clinics for people with serious health conditions. We made great progress working through our vaccination phases and prioritizing those who are at most risk. Vaccinations for people with serious health conditions are largely complete. And then our federal retail pharmacy program. The number of local pharmacies participating in the federal retail pharmacy program has increased. Participating pharmacies now include ReliCare, Hy-Vee, Walmart, Sam's Club, and Walgreens. These pharmacies are providing vaccine for all age groups, and you can see which locations have COVID-19 vaccine in stock at vaccinefinder.org. We encourage residents to take advantage of the first opportunity to get vaccinated that's available to them, whether it's at the health department clinic or a local pharmacy.
Thank you, Director Lopez. Before we turn this over to questions, we have a few reminders that help is here for residents impacted financially by the pandemic. Those who need help with housing and utility costs due to the pandemic can now apply for assistance using the online form at lincoln.ne.gov/rent. You can also call 402-413-2085 for assistance. And more information and the application forms are available at both that website and the resident resource page at covid19.lincoln.ne.gov. Another drive-through career fair is coming up Thursday, April 22nd from noon to 7 p.m. at Gateway near 63rd and O Streets. And employers in manufacturing, healthcare, construction, and much more will participate and promote career opportunities for people at all levels of skill and backgrounds. And on a related note, the City of Lincoln is now accepting applications for hundreds of seasonal, full-time, and part-time jobs, including street construction, parks, pools, day camps, and at our golf courses. And to view the available seasonal positions, you can visit jobs.lincoln.ne.gov and select seasonal opportunities from the menu bar. And with that, we would be happy to take any questions from the media. And I would point out that Dr. Lawler is also still with us.
Hi, Mayor. It's Matt Olberding from the Journal-Star.
Hi, Matt.
Hi, I have a couple of questions for Pat.
All right, she'll be right back.
Good afternoon, Matt.
Hi, Pat. How are you?
I'm good.
So would you say at this point in time that there's enough vaccine locally for just about anybody who wants to get vaccinated?
Well, we're opening up, obviously, to get to those. I wouldn't say that we have enough vaccine for everybody who wants to get vaccinated, but we have an opportunity for anyone who wants to be vaccinated to reach out and get scheduled. We could always use more vaccine.
And then I also wanted to ask you, just simply because we get this question every week when you guys have your news conference, but at what point do you think or do you foresee that DHMs will be relaxed, the mask mandate will go away? Do you guys have a hard target like the risk dial in the green or a certain number of people fully vaccinated or anything like that?
I think today we shared again that our goal is to get 75% of those in our community who are eligible to be vaccinated. That's one of the things that will move us much further. And looking at our positivity rate and our case number, our case numbers are also going to help move us forward in that direction. We're still pretty flat, but we're anticipating we're going to see improvement, and I think there'll be gradual changes, is what we're anticipating to the directed health measures.
And then that's the final question I wanted to ask about the case rates. The case rates have been pretty steady now for about a little over 2 months, right? In that kind of 320 to 350 range, even though there more and more of the population has gotten vaccinated. I mean, is that representative of just, the variants, or is it representative of younger people who haven't been able to get vaccinated yet, making up the majority of those cases?
Definitely related to younger individuals not being able to be vaccinated. And what we're seeing even with our hospitalizations, those in the hospital, that age range has decreased to those that aren't fully vaccinated yet. We're seeing a tremendous drop in cases of those 65 and older, actually, Matt, much lower, as we'll be able to share some more demographics next week at the briefing. But once we see people fully vaccinated, the curve begins to just go down, the trajectory down. But where we're seeing our cases are primarily in those age groups 55 and under, especially those, say, 20 to 49. And we're also seeing variants in our youth, from 13 to 19 or 13 to 18. So that's why we're urging people to get vaccinated. We can definitely see a difference when people are vaccinated. And that's why I keep stressing that that's another really important tool we have, and we continue to advocate for vaccine to be brought into the community, whether it's through the retail pharmacy program or supplied to us at the health department.
Great, thank you.
Thank you.
While you're up there, Andrew, from Channel 7 News, I was wondering, how far do you think pausing the Johnson & Johnson vaccine, if you don't have the Johnson & Johnson vaccines, how far will that put you behind in getting that 75% herd immunity?
That's difficult to project right now. Andrew, we're using some of our vaccines that we intended to use for our homebound individuals that Tabitha has started. We'll be using Pfizer with them. If the supplies decrease and are reallocated from other parts of the state, that will help us for those that are down into those age groups. So it's hard for me to predict right now what that's going to be like. And the FDA is meeting tomorrow to discuss what will be the next steps related to Johnson & Johnson.
And one more question for you or Dr. Lawler. I guess, once you pause this, can you ever restart it and sell people that this is safe, even though the numbers are still extremely low for these particular complications? But how can you ever sell to people that this vaccination is as safe as the other two?
Dr. Lawler, I want to answer that. I'm not sure I'd use the word sell, but I'll ask Dr. Lawler if he'd like to address that.
Sure. Thanks, Pat. I think that first of all, it's completely appropriate that that the vaccination program take a pause and to look at the data that are out there for the Johnson & Johnson vaccine to make sure that we've identified all cases that have this clotting syndrome and that we're aware of potential risk factors. I think there's a couple of things to consider about vaccine hesitancy and how this event may affect it. To me, to be honest, if anything, our experience so far indicates that our safety systems are working. And so we know that we do post-marketing surveillance of vaccine adverse events in order to identify events such as this, which are very, very rare and just could not possibly be picked up in even large phase 3 clinical trials, which are the last trials that happen before a vaccine is usually approved. And those trials for these vaccines usually enrolled anywhere between 30 and 40,000 people. But we're talking about here an adverse event that appears to be on the order of 1 per million. And so that's not going to be detected in the regular clinical trials that precede approval by the FDA. But we've been monitoring adverse events in post-marketing, so after the vaccine has been distributed and administered, and that's how we picked this up. And so, again, to me, this indicates that our safety systems are working very well and are able to pick up what are incredibly rare events, and that the FDA is looking closely at these events to make sure that there are no predisposing factors that could potentially allow us to tailor the use of the vaccine. What we know is no vaccine is perfect. There is no vaccine or drug that is without side effects. And if you look at the overall numbers again, we've seen 6 cases identified in essentially 7 million Americans vaccinated. That's fewer than 1 per million. And we know that your chance of developing severe disease from COVID-19 and even dying from COVID-19 are far greater, 1,000 times greater if you look at Nebraska. So we've lost over 2,200 people in the state of Nebraska. That's a rate well beyond 1 per 1,000. It's about 1 in 870. I just ran the numbers. Even if you are an adult in between the ages of 45 and 54, where I think we generally don't see that as a high risk group, we've still lost 1 in 2,500 Nebraskans. So 1 out of every 2,500 Nebraskans between the age of 45 and 54 has died from COVID-19. So you compare that risk to the risk of potentially 1 in a million with this adverse event. And again, so far, only 1 out of those 6 cases, 1 out of 7 million vaccinated people has been identified as a fatality from this side effect. So the balance for vaccination versus non, even with the data we know now, far skews to the side of vaccination. What I think we will learn potentially as we pause administration of the J&J vaccine and look at the data is potentially where there are risk factors, again, that might allow us to tailor the use of this vaccine to limit the side effects that we encounter and to maximize the benefit of the vaccine. But again, overall, to me, this indicates that the system works. It's picking up safety signals that are quite rare. It's taking appropriate action. And to me, this gives me more confidence in the safety of the vaccines that we have out there and the systems we use to make sure that we understand their safety profiles fully.
Thank you, Dr. Lawler.
This is Brent with Channel 8. What's going to be done with the Johnson & Johnson doses that were scheduled to be used for the upcoming clinics? Are those going to be able to be used down the road somewhere?
Brent, it's really too soon to tell that. We'll just hang on to that vaccine. They're all coded in by lot numbers and all of that. So we'll just continue to keep those where we have them in the freezer and wait until we get more information.
Okay, and kind of on a different note, just looking at the most recent deaths that we've seen, they've all been older people, I think all over 60, and the 3 this month, all over 70. So these are people who would have at least had the opportunity to be vaccinated and probably likely had enough time for the vaccine to fully kick in. Can you say whether any of those people had been vaccinated or if that's something that the health department is tracking?
Well, we definitely note if people are vaccinated or not. And probably what I can say is that even though we may feel there was an opportunity to be vaccinated, not everyone sought that opportunity. So that's what I can say about those situations.
Hi, Pat. It's Matt from the Journal Star again. I had another question for you. Can you sort of quantify how many, what you'd refer to as maybe adverse events you've had in vaccinations that you've done? There was the incident last week where a city council member said he had a stroke after receiving a vaccine. We personally here at the Journal Star heard from another person who said they had to be taken away from PBA in an ambulance and were diagnosed with a mini stroke. I haven't confirmed that yet, but I was just wondering how often that happens, or I'm assuming it's a very rare event where somebody has to be has to go away from the vaccination event in an ambulance.
Yes, rare, and I'm not even familiar at all with the last situation you mentioned. Nothing's been reported to us. We have had some people who had urticaria or like a rash-like reaction, a couple of people. Other than that, other than some other minor things that happened that weren't really related to the vaccination, more like perhaps issues with receiving a vaccination itself in some of the younger age group, we really haven't seen any adverse reactions at the clinics. And I did read what was provided in the paper about another situation, and all I can say is that as we become aware of things, we report them into the CDC adverse reaction site, and all providers and even patients are able to do that, and we certainly encourage that, and we provide information to those that we vaccinate to do the same.
Yeah, hi Pat. This is Bill with 1011. One more quick follow-up. As that age group for people who qualified has dropped so quickly from, you guys anticipated 40 plus this week, and now you're down to 18 plus. Is there a concern that there's maybe more hesitancy to get the vaccine among the younger demographic in Lancaster County?
We're constantly analyzing that. We just haven't had enough time to really see if that's the case or not. And so we're looking at those demographics, and we're also looking at where we have specific age groups, kind of looking through the community where we might need to do some specific outreach. So I'd say give us about 10 more days and we can give you a more accurate answer on that.
And is there a reason those releases say 18 plus instead of 16 plus?
We wanted an opportunity to talk with the schools and to share information today so that parents could hear about how that could happen for them at their students' location at the school. So we just wanted to be sure that parents knew for them that this would be available at their local school and that they could use that as an opportunity to receive the vaccine. So that was purely the reason, Bill. And plus, we're trying to get the students that are 18 and older that don't need, that are in higher education or who are out working to get into the clinics and get vaccinated.
Thank you.
Oh, Pat, before you go, Nicole Weaving from NTV, as one final follow-up. I know that you already mentioned in the press release that for any prior or future clinics that you had that were going to use Johnson & Johnson, they've been replaced with Moderna and Pfizer. Should we expect any impact then on the rate of the number of people that can get vaccinated or the number of clinics you guys will hold now that you're not able to use that supply?
We had just received, this was a large amount that we received, but we haven't received that much Johnson & Johnson in Lancaster County. We received 3,000 doses previously, then another number of doses that we were going to be using with our long-term care and shelter locations. So we don't, the impact, our greatest majority of vaccine has been Pfizer and Moderna to date. So I don't really anticipate that we're going to have a huge impact because other parts of the state are changing in the numbers of people coming in to get vaccinated, and the governor and the Department of Health and Human Services are constantly monitoring that and are reallocating vaccine.
Thank you.
Uh-huh.
Thank you again to Director Lopez and to our guest, Dr. James Lawler, for being here today. I do want to remind everyone about those non-pharmaceutical interventions that Dr. Lawler referenced. You know, while we are so pleased to have 40%, nearly 40% of our community fully vaccinated, the flip side of that is the majority of people still don't enjoy those protections. So in the meantime, we all can do our part to extend the web of protection and do that by washing our hands frequently, wearing our masks faithfully, and by watching our distance from others. Those will continue to be important practices to help see us through past this pandemic. And in closing, I want to extend my best wishes to our Muslim community members as we welcome the beginning of Ramadan. Ramadan is a time for reflection and devotion and compassion toward others. Many will fast during Ramadan, share break the fast meals with family after sunset, and engage in acts of service. So to our Muslim friends, family members, and neighbors, I wish you a happy Ramadan or Ramadan Mubarak. Tomorrow, Wednesday, April 14th, marks the Yazidi New Year, or Charshama Sara Saleh. Best wishes to our Yazidi friends and neighbors on the eve of this new year, a milestone that represents the renewal of both nature and hope. And with spring blossoms painting our city pink and white, with vaccinations protecting more and more of us each day, and with seniors enjoying prom as a rite of passage once more, that renewal of nature and hope feels just right for this moment and something worth celebrating. Thank you all for tuning in. Thank you.